So could you please tell us about little bit about the pieces of osteopathy? Means like what are the subjects osteopath is going through? Like when we have done our whatever medical degree we have background, like we have to read anatomy, physiology, pathology, pharmacology, and all these things. So as a physio background, we read electrotherapy, exercise therapy, and all this. So in osteopathy, there are a couple of subjects which we have to read, like cranial osteopathy, like visceral manipulation, like fascia and all this. Could you please explain us a little bit about those subjects so that everyone can understand what osteopathy are dealing with?
Sure. Okay, first of all, as a PT, most of the people that I teach around the world are physical therapists. That's most of the groups. In Canada, they are mostly RMT, which is registered massage therapy, not to be confused with how massage is in other parts. In Canada, it's a college degree. It's a very high level of education, as is PT. So these are perfect substrates for manipulation. As I said, in the country of its birth, in the United States, you'd have to search to find a DO who does osteopathy. I would get a patient say to me, you know, my family doc, I just realized their initials are DO. They never did any of this. Why is that? I said, I can't really answer that question for you. They went into family medicine, they're busy, they're doing medicine. So that's the problem with education. Physical therapy, or in Canada, the registered massage therapist, you have the backgrounds in anatomy, physiology, you are the perfect substrate for osteopathy because you understand palpation and you have all the medical background that's appropriate for it. Very often there's the occasional MDs that I'll teach. It's more difficult because they have high level medical knowledge. The palpation skills are not the same as your skills. So from an education standpoint, this is a perfect continuation in my view. From a medical standpoint, it is a wonderful option, particularly for places where not everyone has access to care. I'll just use India as an example since we're speaking from there now. You're very wealthy people here, we don't worry about them. They'll fly to Germany, they'll fly to America, they'll get what they need. You have excellent hospitals here where things can be obtained. But for the very, very poor, as you start to reach out into regions that are less accessible, where life is really hard, osteopathy might be the only contact they're going to have, or with their physical therapist. So they can't afford the surgery, can't afford the medicines. I'm not saying I have the answer to everything, but I have an approach to everything. I'm not saying I can make your cancer go away, but maybe I can make the last 6 months of your life more pleasant. So there's many things that we can do with our hands, and that's why I should reach out there. I clearly deviated from whatever your question was.
Okay, I'm going to ask you again.
Oh, I
Could you
remember.
please tell us about what
telling
are the
you.
things we are going to learn in osteopathy, like cranial osteopathy?
I got it. So again, what I learned in school and after school, you tend to learn whatever your teacher liked in school. If your teacher believed the muscle energy, this was a big feature for you, and if they said cranial, I don't believe in it, then you didn't get exposed to it. So what I try to do is expose people to all the colors of osteopathy. You become what you want to become. That's what A.T. Still wanted for us. He said, as long as you understand the anatomy and the physiology and what you want to change, you can do it how you want. What I got from teachers was my way or the highway. Even though the founder said he wanted us to be artistic. It's a science, but it's artistic, the application of it. So some popular things you might run into. People know cranial as craniosacral therapy because John Upledger popularized that name. I've already told you I don't care what people call it. I learned it as osteopathy and cranial field. It's a very deep, it's a river that runs much deeper than just the idea of a therapy. But there's a motion that happens in your skull that can be used, can be felt on different levels, either mechanically or on an energetic level as a body system. Like you have a pulmonary system, you have a cardiovascular system, you have a cranial system. It's a motion that we can palpate throughout your whole body. It ends up being a very important modality for a lot of disabled kids that I see. When no one knows why the autistic kid's not talking, I don't know why they're not talking either. I'm not claiming to know that. I go through their body and say, what doesn't feel right to me? I try to correct where tension feels wrong. I do that a few times, then we'll see if you get better or not. I really don't have the answer, but neither does anyone else. So cranial has been very useful in the energetic realm. It can be mechanical, if that's what you understand. I believe it's much more than that. Visceral. Visceral manipulation has gained a lot of popularity, I'd say, in the last 20 years or so. The idea of organ manipulation, it sounds scary, okay? But to lift your liver or to lift and move organs around, moving normal organs to override muscular problems, because when I move your organs temporarily, it will override a lot of aches and pains and other things going on. You can move organs that are not functioning properly, like commonly irritable bowel disease, people that have diarrhea, constipation, and no medical reason for it. You can move these organs, and sometimes the action of moving them, they find a better set point and start operating properly. Now these theories are theories. You talk about cranial theory, no one has proved it. Theory is we think this is why it's working. We see the result, can't prove it. Medicines, we can prove sometimes we can't. They kind of keep this secret. Medicines are sometimes approved for one use, and then as doctors, we use them for things that are not approved. As speaking to other doctors, we find that this works for this condition, but the government hasn't said it's okay. That is all the time in medicine, all the time.
Like fibromyalgia?
Fibromyalgia, the medical treatment for fibromyalgia, we would say, throw mud on the wall and wait till something sticks. They'll treat fibromyalgia like they'll treat migraine headache. So many different classes of drugs. And we have theory, we know a lot of how the drugs work. Sometimes we don't even know how they're working. Case in point, SSRIs. The studies never proved what they claimed it proved. I know it's shocking to believe that a drug company might lie to us, okay? Years ago, they said it was serotonin levels that were responsible for your mood. The studies that they actually didn't prove that. It's now, the mask has been taken off, that the studies never proved that. Having said that, some people on SSRIs feel better from their depression. So I'm not saying the medicine shouldn't be used. What I'm saying is they rushed the study out. There's billions of dollars in this. And they said, this equals this, now let's sell it if it's not killing people. And they start selling it and making it. But go back to the studies. They now said they can't link whether you have a high or low serotonin level, whether or not you're necessarily going to be happy or sad. So what I'm saying is the medicine may or may not help you, but the studies don't prove why it worked. And we have a belief in medicine that we don't have in manipulation. So my approach is, I'm not trying to convert you to any kind of belief. I'm going to do something to you that does not have the side effects that medicine has, does not have the side effect that surgery has, does not possess those kind of dangers. We'll do a couple treatments and see if this helps you. If this helps you anecdotally, then it worked. We'll still try to think about why it works. So visceral, that's organ manipulation. Another popular one, myofascial. Myofascial release, or different names that you might have it. Your fascia is this spider web that's covering your organs and your muscles and everywhere throughout your body. This spider web is about 68 times stronger than bone. People don't realize that. You see a spider web, I see on my deck, I see a string that goes 15 meters over to my roof. Not 15 meters, maybe. Yeah, 5 meters over. Like, how'd that spider get there? How's it survive the wind? That's what your fascia is. It keeps your organs in place. It keeps your muscles in a place so that they function properly. And it can malfunction. It can get infections. It can heal incorrectly from unnecessary surgery. We call that iatrogenic. And it can be treated. And it can be changed. It's a very big component. Your muscular problems are not bony, they're not soft. Fascial problems, they're both. And if you want to add a layer to it, they're psychological. Case in point, you have back pain, you're a young person, You go and help your friend move his furniture. You hurt your back. All right, it's annoying. You have to go back to work. You're frustrated. Now after a week of it, and that normally doesn't happen to you, you're really getting a bit angry now. It's really a nuisance. So you go to your friends. Hey, help me, fix me. They try to help you. They try to fix you. It doesn't help. Now you're starting to get slightly worried. Why am I having back pain for 3 weeks? So you go to the important people, the ones who really fix this. And they work on you, you do everything, and it doesn't work. Now you have a new emotion. It's not frustration, it's fear. What if this never changes? Now 6 months later, you've gone everywhere, flown all over the world, it hasn't changed. Now you have a different emotion. You have accommodated, because you've gone to the smart people who told you, well, if I can't fix you, it'll never get better. This is your life. And you figured, well, this will be my life. So fibromyalgia is a sloppy medical definition of multiple tender points around your body with a very vague theory that some virus came from nowhere. They used to believe Coxsackie virus or Epstein-Barr virus was one of the etiologies. So they give you no clear reason why you have this pain. They say it's associated with chronic fatigue. It's associated with depression. What a shock. If it costs you more biomechanically to go from here to there because you're in pain, yeah, you're going to be tired. And if you're tired and in pain, your mood's probably depressed.
Yeah. It's like
This is not scientific at all. It's just describing your symptoms. So people that have these kind of complaints, very often, you can start taking apart pieces of it. They don't have fibromyalgia. They have pain here, 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 and here, and here. Start taking pieces apart. Very often you can make changes in these people. But they've been told by important people that it will never change. And that's a potent bad pill, because it starts to work on you emotionally. Your emotions are malleable, just like your physical problems. Physical problems over time affect your emotions. Emotional problems over time affect your physicality. You can't have a sad outlook on life and then not start to have physical problems.